In my clinical practice, I often see men delay seeking help for erectile problems. Most assume it's just stress or simply age catching up. But what many men don't realize is this. Erectile dysfunction can sometimes be the body's earliest warning sign of an underlying health issue. Hi, I am Dr. Karthikeyan, Andrologist, and in this video, let's clearly understand what erectile dysfunction really means and when it's important to seek medical attention. Erectile dysfunction isn't just about sexual performance. It can be an early health signal. Medically, erectile dysfunction or ED is defined as the persistent inability to achieve or maintain an erection sufficient for satisfactory sexual activity. Now, occasional difficulty can happen to anyone, especially during periods of fatigue, stress or emotional strain, and that alone is not a cause for concern. However, when the problem becomes recurrent or persistent, then it deserves proper evaluation. Why? Because in many cases, ED is related to reduced penile blood flow, and that can reflect early vascular changes including cardiovascular disease. The penile arteries are smaller than the coronaries. So, there is a developing circulation issue. Erectile symptoms may appear before chest pain or cardiac symptoms. That's why ED is not just a quality of life issue. It can be a early clinical marker. Most men think it's stress or age, but the root cause often lies deeper. The most common causes of erectile dysfunction are physical. These include vascular insufficiency, which is a reduced penile blood flow, hormonal imbalances, which may be anything but particularly low testosterone, and metabolic conditions such as diabetes and hypertension. Also, obesity, high cholesterol, smoking, and a sedentary lifestyle. They affect the vascular and hormonal health further. Psychological factors like anxiety or performance stress can further contribute. That's why self-diagnosis or over-the-counter remedies frequently fail. They may temporarily unmask the symptoms, but they do not address the underlying cause. If you are facing erectile difficulties, the real question isn't why me, it is what is causing it. A proper andrological evaluation starts with a detailed medical history and a focused physical examination. Based on these findings, we may then recommend some tests. Hormonal testing, which also includes blood sugar and a metabolic screening and a lipid profile. We also do a vascular assessment whenever it is indicated. Remember, treatment is always individualized. It may include lifestyle modifications, oral medications to improve the penile blood flow, and testosterone replacement in carefully selected patients. Also, management of underlying conditions like diabetes or hypertension are of paramount importance. The good news is, when treated appropriately, a significant proportion of men experience meaningful and sustained improvement. Your daily habits influence your erections more than what you think. Regular physical activity improves the endothelial function, that is the inner lining of the blood vessels, which is actually directly affecting the erection quality. A balanced diet supports vascular and metabolic health, and reducing alcohol intake, quitting smoking, managing stress, and ensuring adequate sleep. All of these play a very crucial role. In fact, testosterone secretion follows a circadian rhythm, which means poor sleep can significantly affect hormonal balance. Sometimes, improving lifestyle alone can dramatically improve erectile function. So, when to consult an andrologist? An occasional difficulty is common, but persistent difficulty is your signal to consult. If erectile problems continue for several weeks or are accompanied by these things, a reduced libido, loss of morning erections, persistent fatigue, or known conditions like diabetes or hypertension, it is important to seek professional evaluation. Erectile dysfunction may be the first sign of a cardiovascular disease or hormonal imbalance, as we have been discussing. Early intervention not only improves sexual health, but it also prevents future systemic complications. Remember, erectile dysfunction is very common and it is completely treatable. So, there is no need for hesitation or embarrassment. ED is a medical condition just like diabetes or hypertension, and in most cases, it can be effectively managed. Open discussion and timely consultation allows us to identify the root cause, restore sexual function, and protect long-term health. If you are experiencing persistent symptoms, then don't ignore them. Seek medical advice early. Your health deserves attention. So, ED is not just the end of road. It is not the end of intimacy. It is only the beginning of a deeper health conversation. If you found this video helpful, then like and subscribe for more men's health updates. Share this video with someone who needs more clarity but hasn't yet asked for it. Remember, early evaluation leads to better outcomes.